welcome to Mums at the Table. It's great to have you with us. I'm Rachel.
And I'm Shona. And what have we got coming up today?
I was going to ask you that. I know.
I'm asking you.
She got in quick, didn't she? I know we've got Dr. Peter here who'll be talking women's health.
Yes.
We've got Amanda, our dietitian. She's with Gia actually chatting today about nutrition and food. Today we're talking about motherhood and cultures. And we know we're familiar with our own culture, you know, Australia, New Zealand. But what do other cultures do when it comes to parenthood, motherhood? And what can we take on from theirs to benefit us?
There's just looking at different countries, you can see that there's different ways that mothers mother their children and how mothers are looked after when they've had children. Yeah. And I think as a Western society, we could take a lot of really good tips from them. One of them that I saw was the village and how, you know, these women are just engulfed with other women and just how they look after their new mums, and they're there to give them guidance and tips and, you know, just to help them through that really strange new time of being a mother.
Yeah, I read like the Maasai tribe, you know, tend to, it's almost like the men vacate for a little bit and the women sort of come in, dote on her, you know, for a month or something, you know, helping out with the housework and the cooking and that sort of thing.
You were brought up in Papua New Guinea. Yep. So did you notice any differences, or your mum would have noticed any differences?
Yeah, for sure. I even remember them, you know. I remember going to the shops and mothers would put their babies in a bilum bag and hang it on a post and sort of go and do their thing in the marketplace and then come back. But there were other women there to watch.
Right.
You know, they relied on each other, whereas here we've sort of got this real pride thing about independence, teaching our kid to be independent, and we're going to be independent when we're mums and we're going to go straight back to work.
Do you think it's that we want to be, you know, like we're striving for that, or is it because we live in a community that's quite segregated now? Like, for me, my family's overseas.
That would add to it, yeah. I was going to say, but I agree with you. I think we do segregate a bit. I think we've sort of built that society for ourselves in a way, and I'm not going to go into why, but there are definitely things. It's interesting to read around all the different cultures and what they do with their kids and how they raise them. And what we could take from that and learn and actually benefit from each other's culture.
I watched a short clip on babies on YouTube, and it was really interesting. It didn't matter how the mother mothered, all the babies did similar things. Like, they all crawled at similar times. They still spat with each other and, you know, grabbed and stuff like that. So I think there's this innate Connectedness, yes, of mother and child and how that comes together.
That's what I noticed a lot in New Guinea. You know, the baby's attached to the mother so much for not just the first few months, not handing it over, but they're really attached to each other for a long time. There's a lot we can learn. I know that there are going to be stories out there and I would love to hear them personally because I want to take them on. So please jump onto our Facebook group and share some of your stories there.
Hey, I'm so glad you joined Dr. Hartshorn and I for a chat. Now, we're talking about milestones in our babies, newborns, toddlers. You know, it's so easy to compare with other parents and their children.
And I think sometimes that can be, you know, a good thing, and that sometimes it can be competitive and a downside about being in a mother's group.
What are we looking for? What's normal?
Well, I think the first thing to say about development is that there's a range of normal that we accept as being normal. So, you know, there are some babies who walk, for example, if we take that skill, some babies who walk maybe at 9 or 10 months, and yet there'll be some babies that won't walk until they're 18 months, and both can be quite normal babies. So it's important not to get too fixated on one particular skill, but realise that development is a process, and it's different in different babies.
Okay, now we're talking about walking. When should we be concerned if our child is not sitting up, or you know, what age?
So look, in terms of walking, I mean, I think I would be concerned and suggest that that you seek a medical opinion from your local doctor if your child is not walking by the time they're about 18 months old.
Okay.
Okay.
They can't stand up.
Yeah, well, standing normally comes a little bit before walking.
Right.
So, I mean, by, let's say, 12 months, your child should be able to stand up holding onto the coffee table. If they can't do that, then once again, I think I'd seek an opinion.
And it's such a great moment for parents. I know a lot of parents take the photo when they've taken their first step and things like that, or even when they've said their first word.
Yes.
So what are we looking for when it comes to our babies communicating?
Communication, yeah. So this is a development that goes right back into the first couple of months of life. The first communications are things like eye contact, cooing noises, you know, oohing and ahhing that happens often around sort of 3 or 4 months. And then after that, where, you know, babbling sort of happens generally between 6 and 12 months, and that's usually when you start to hear your first clear words. Remember that the words, obviously, to start with, are not going to be very clear and sound like what you and I would say, but yeah, that's usually when they come, and generally I would expect by the time a child is 2 that they should have a vocabulary of around 30 to 40 words, and stringing a couple of words, 2 or 3 words together.
Is there anything that we can do to help our child along?
To be honest with you, I think social interaction and reinforcement is really important, and that means be there for your child. Look at them, respond to what they're doing. You know, look at things that they want to look at and label them and name them. You can play games, pointing things out in books or when you're out for a walk.
Yeah. And what about, is there some things that, when should it be a concern?
Well, if we weren't at least meeting that list of 30 or 40 words by the time they're 2, I would be most concerned about their language development. And I think in particular, I would really draw attention to their hearing. So we need to make sure that your child is hearing. And if you're in any doubt, go and get it tested.
Yeah, thank you so much, Dr. Hartshorn, for those tips. Now, I know they will help a lot of parents out there who are struggling with understanding the differences between different children. But don't forget, your child is unique and is wonderfully and fearfully made.
Food hygiene. That is our topic today. Hi, Amanda.
Hi, Gia.
So we're going to be talking about food hygiene and how to protect our families from contamination, from virus contamination, and how we look after our food. Now, although it's not specifically about COVID, we have to understand that those things are happening in our world today, and people have been listening and viewing our content and actually asking this question. So have you got any thoughts about contamination from, you know, not just COVID, but, you know, flus in general, and how to look after the food?
Yeah, sure. Well, you know, we're going through COVID-19. It's been around for a little while, and I think it's going to be around for a while still. In terms of that particular virus, the advice was that there's no evidence to suggest that it has been transmitted by food or food packaging. And I think this is the same for other respiratory viruses as well.
Yep.
So the main risk for getting respiratory viruses is when you're in close contact with someone that has it. There's droplets in the air that get into your eyes, nose or mouth. In saying that, though, it is potentially possible to get these viruses from touching surfaces that are contaminated and then touching your face. That's why we've heard a lot about washing our hands regularly and trying not to touch our face all the time as well. The other thing is that with viruses like the flu, is that we expect that if it is on our food, our digestive system, the acid in our stomach will actually destroy the virus.
I was thinking that. I was thinking, how would that work if it does go into your gut?
Yes, yeah. So that's what I've read anyway. Yeah.
Okay, so in general, how would we take care of our food so that we can lower the risk of contamination generally?
Yeah, so it's really just normal safe food practices. So first of all, wash your hands with soap and water. Wash them well before you handle any food, before you eat. And also, as always, wash your fruit and vegetables. So wash just with running water and then...
And not soap?
Yes, so that's the other thing.
Because my grandma used to wash it with soap.
Don't use chemicals like soap or dishwashing detergent or anything like that. Just wash with running water. Hard vegetables or fruits like potato or apple, it's a good idea to scrub it with a vegetable brush just to remove any dirt and anything else that's on the surface as well. The other thing is also rinse fruit and veg that you'll peel too.
Okay,
because when you peel it, it can get in on the vegetable.
Because sometimes I think, I'm just in a hurry, let's just take it off the skin and it'll be fine, but it's good to rinse as well.
Yeah, so rinse it before you peel it.
Okay,
yeah.
That's great. Well, thanks guys, I like that. At least now our mind is at ease, because I feel like these are things we need to talk about, because people are thinking it even if they're not saying it, and you've put my mind at ease, that's for sure. We'll see you guys with another topic next time. See you later.
Hey, thanks for joining Dr. Wood and I for a chat. We're talking about safe medications to take when you're pregnant or breastfeeding. We're not bulletproof. So
Correct.
as mums, you know, we can come down with illnesses and whatnot, but are there some safe medications that we can take that won't affect our baby?
There's a lot of safe medications you can take. I'll just talk about common basic ones. So it is totally safe to take Panadol. And so it's much better for you to take Panadol than it is to have a fever. So take the Panadol if you think you're getting a fever. It's safe to take all your asthma medication, like your inhalers and your puffers and your preventers. It's much better to use those than it is to have asthma. Common antihistamines. You know, if you get a bit of a flu, like a runny nose and you want to try to block it up, they're fine.
Hay fever.
Things you shouldn't be taking is a pseudoephedrine, right? But things like Claritine and Telfast and those other sort of non-drowsy ones are fine to take. Even the polaramines and the phenergans are also fine to take. So those antihistamines are generally fine. There is an organisation called Mother Safe, which you can look up on the internet. They've got a website and they've also got a phone number. And if you've got a question like, you know, can I take this, or can I get a spray tan, or can I go and get my hair done?
Or even do your nails because of those chemicals.
Fumes and stuff. You know, if you've got questions, I'm going to paint my house and I'm worried about the paint fumes, call Mother Safe. They are a bunch of pharmacists. It's sponsored by the government. It's incredibly useful, and they want to give you information as you need it. So don't be afraid to call Mother Safe if you've got a question. Also, for doctors prescribing your medication, you better let them know that you're pregnant. You know, so
or breastfeeding.
You're breastfeeding. So majority of antibiotics are safe. There are a few that are not recommended, and it'd be really important to know that if you're pregnant, So breastfeeding, likewise, majority of medications that you would normally take are fine. And now you can add things like Voltaren or Nurofen or those sort of non-steroidal anti-inflammatories. That's safe to take whilst you're breastfeeding.
I didn't know.
It's safe to take antibiotics again if you need it. There would be some herbal preparations out there. There's a million. Again, I'm not familiar with all of them. So if you've got any questions about that, call Mother Safe. They'll be able to give you all the information because they know all that sort of stuff. But as a general rule,
don't suffer. Go to the GP.
You know, and
see if there's something that can help you.
There are other good pain relief. If you're having problems with back pain or pubic symphysitis stuff, you need stronger painkillers. They're all safe to take generally. So as a general rule, things like Nurofen is not safe to take. Voltaren is not safe to take. That includes Sudafed. Don't use the Voltaren gels. They're not appropriate to take whilst you're pregnant.
Or breastfeeding.
But you can use it while breastfeeding. So you can use. It's confusing. Don't use the Nurofen when you're pregnant. You can use it when you're breastfeeding.
Good.
It's a difference.
Thank you so much, Dr. Wood, for those tips. I hope that's helped you.
So here is, I guess, a bit of a deep one. What do you do that nurtures the spiritual culture in your home? And that is a tricky question because it really takes a bit of thought.
Well, like I've said in previous episodes, I wasn't brought up in the church, so I came into the church, and that's a really interesting question, because how do you learn it if you haven't been exposed to it? And that took us a long time to actually learn how to have a Christian perspective in a home. You know,
so where did you learn from them? Where did you sort of pick up on some of those? A lot
of it was going to our friends' places. We do a thing opening and closing the Sabbath, and so it was going to their houses and experiencing that with other people, and then trying to bring that home and replicate it. Gary had to teach me a lot of this stuff. Because I just didn't know it. I had no idea. Like, even going to church was a foreign thing for me. And, I just had to pick it up as I went along.
I guess I'm the opposite. You know, I've been in church all my life, you know, come from generations of people who've been to church. And so I think that was just rolled from when I was little, you know, and I rolled into that. But it's as an adult, you talk to your partner and you go, hang on, that's great. But what do we want to do for us, even before kids? Like, how do we want to, I guess, bring God and worship, you know, in our home and set that tone? And for us, I think particularly for me even, I've probably dominated this one, but really to consult with God on everything. And I'm like you, we do we celebrate Sabbath, so that's a Friday thing through to Saturday. So Friday sundown to Saturday sundown. So we celebrate that Sabbath and that rest as well. And that's a huge part of our spiritual culture.
How did you have the discussion with your husband about what you were going to choose and what you weren't going to choose?
I think it started off with what we both could bring, you know, what we both sort of had experienced growing up in our own families, because he's also a Christian. And we discussed how that worked for us. Is it something that, you know, we felt connected with God on? And sort of we just jostled that, and, you know, you respect each other and how you both worship God, because we do it very differently.
Yeah,
you know.
yeah. Like we, for us, it was the same thing. But I found it was really important. It brought our marriage together. It's brought our family together. We've had an external family from it, you know, our church family and friends and everything. So it's been really important for me.
Yeah, I love that. Look, we're going to have to cut it short. Sorry, that is all we've got time for. It's been great to have you with us, but we'll be back next week with more great topics. We'll see you then.